Kia ora koutou and welcome back. Really excited for this afternoon's continuation of our program and the conversations this afternoon. We've got another fabulous three panellists sharing their whakaaro with us this afternoon, beginning with Danielle Oaks. Danielle is Pouarahi of Te Ahi Kaa Indigenous Solutions, kaupapa Māori Health and Disability Service covering the Te Puaha, Waikato and Tāmaki region. She has worked with the community sector for the past 20 years, with many of these spent in public health, epidemiology and Māori health. Her background and experience includes working in mental health and suicide prevention, kaumātua abuse prevention, family and sexual violence prevention and disability services. Te Ahi Kaa has also developed an innovative kaumātua peer support service and are currently co-designing a community toolkit to share about the learned mātauranga and success of this kaupapa. Following Danielle, we have Nilima Venkat. Nilima is a qualified social worker and has been involved in providing social and community support for the past 2 decades, addressing inequalities, specifically for elderly from Indian and South Asian communities. Her expertise and passion lie in intervention and prevention of elder abuse. She is currently the head of operations at Seva Charitable Trust. Her dedication and work in this field has earned her many accolades, including a member of New Zealand Order of Merit and Kiwi Bank Local Hero. And she's also just returned from travelling, so if you can see the jet lag, I can't see it, but we're very lucky to have her with us. And finally, for this panel, we have Hanny Naus. Hanny has had roles in social work and counselling in hospital, residential and community settings with older people and with people with physical, intellectual or brain injury disabilities, as well as professional supervision and teaching in tertiary education programs in social work and in counselling and addiction studies. These provide a valuable experience for her Age Concern New Zealand role, which she's been in since 2013, advocating for older people's wellbeing and elder abuse and neglect prevention. So welcome to all of our panellists, and we're going to start with Danielle. Welcome.
Kia ora everyone. E rere ana taku aroha nui ki te whānau o te kingi tanga, mō toku iwi o Waikato Tainui. May we continue to uphold the vision of Kingi Tuheitia of ko tahitanga, moi mai rā e kingi. Ko waiau, ko Tainui te waka, ko taupiri te mauga, ko Waikato te awa, ko Waikato te iwi, ko Ngāti Tipa te hapu, ko te ao marihi te marae, ko Danielle Oaks tuku ingoa. I'm a little bit nervous to stand up here. I actually don't know why. I really love talking about our kaumātua. They're my biggest flex, so I today carry the voices in which I'm really privileged to be able to do that. My goal for my 10-minute presentation is to bring the voices of our kaumātua in which they have graciously shared with me over some time. And so when I get a little bit nervous, I picture their faces, I see them sitting here in the audience, and I stop, I breathe, and I know that it's an opportunity for their voices to be heard. So we have been really privileged to mahi with our kaumātua in Te Puaha. Part of that work we have done was setting up a kaumātua peer support service. And this was a service that was driven by our kaumātua. They came to us, they said, this is what we want, this is what we need, and my job is to make it happen. And I love that relationship we have with our kaumātua, because what it means is that every single thing that we do is driven by what it is that they want. And that is very important for our kaupapa at Te Ahi Kaa. What I want to share is not necessarily the entire kaupapa, because we'd be here for a 2-day conference, but really the outcomes of utilising a pūrākau evaluation approach in which our kaumātua were the strength in driving from the get-go. So utilising mātauranga Māori in the way in which they are able to see themselves. And so what does it mean to utilise a pūrākau approach? Well, for us back home, Te Puaha Waikato, we looked at What are the things that make us really unique as te pōha? What does te pōhatanga actually mean? What does it look like? And so according to Te Pōha Pūrākau, Rehua, which is the atua of the stars and heavens, had taken Matariki as a wife. Together, they had a child named Ngā Karu o Matariki, the eyes of Matariki, or otherwise known as matamata, or otherwise known as whitebait. This name comes from the translucent appearance of the whitebait that glitters in the water, which is very similar to the stars. And as matamata progresses through our awa, their name changes as they progress. They go from matamata to karohi, and then finally to whitebait. They are left without parents to be nurtured by the wai, and they hug the side of the river for safety and protection. And so it was this pūrākau that was decided that we would utilise the kōrero, the story of whitebait, which if you ever come down to Te Pūaha Waikato, you would know that that is a significant kai for us. And if you're really, really lucky and you give me enough notice, I will be able to make you a fritter. And so it was decided that that pūrākau, as it is a delicacy to Te Pūaha, and it holds huge cultural significance, that they wanted to use the connection of matamata to the way in which they were able to shape their world. One of the things they spoke about is to successfully catch matamata. It's not easy. You required an understanding of where the matamata were going to run in the river each day as it changed. So you needed to understand the environmental conditions, the taiao, the maramataka. You needed to have the correct equipment, and you needed to have an understanding of te puaha, karakia, and tikanga. And so there was a traditional technique that was used, which is called the ariari board. And so this is the white bark of the cabbage tree. I don't know if I should have put some pictures up, but the cabbage tree, if you kind of pull the bark back and you put it into the water, it kind of glitters. And so our people used to use that so that they could actually see where the whitebait was running. And what had happened is that over time, that our awa became polluted. And so it meant that utilising the ariari board had no use anymore, because it didn't matter if you popped that into the awa. It meant that the water was so heavy, was so dark, that you could no longer see any of our whitebait. And so that then puts into our people a risk of not being able to access traditional kai that we share with each other. The water quality declined, and so too has the visibility. In 2012, a survey was done that highlighted the number of benches being built. Now, I don't know, anyone here actually has been whitebaiting before? Kyle? Oh, okay. So how whitebaiting works, particularly in Te Pōha, is that every whānau has a bench. And a bench can be anything from a chair to a wharf to a whole entire whare. And what had happened is that these benches were slowly disappearing. And or other whānau that do not whakapapa to Te Pōha would come in, take away your bench, and then erect a bench of their own. And this was a challenge for our whānau, because our whānau were now moving away for work and they were unable to get home to protect their area. It also meant an erosion of some of our traditional plants and the reduction of traditional names. And there also became quite a pollution of our awa. And so the long-term protection of access rights for whānau was no longer there. And so why was it that they wanted to utilise the pūrākau of whitebait in terms of the kaupapa that they were delivering? Because it was about the restoration of our whitebait, but more than that, it was about the restoration of mana motuhake. And so really quickly I'm going to go through, I think it's 4 kind of key sections that they came up with. The first one was about whānau. And it's about acknowledging that kaumātua and whānau is at the heart of what we do. Like the matamata, being nurtured by the wai, hugging the side of the awa, kaumātua and whānau-led practice is about their ability to make decisions about navigating their lives. The what, where, when, how, who, and why. The next part is about kaitiakitanga, which is about providing protection and care through an intergenerational responsibility. So as we identify areas to protect and restore in terms of regeneration of whitebait, and we look to restore the ecosystem so that matamata can thrive, kaumātua ask the same questions of themselves. What does our ecosystem look like, and what do we need to do to restore that ecosystem so therefore we are thriving in that space? The next part is whakapapa. So relationships are connected through te ao kiko and te ao wairua. So the life cycle of matamata is from te ao wairua, which is before they are born, through to te ao kiko, which is the physical world. And it is how we connect through our relationships. Through whakapapa, we acknowledge that we are the descendants of atua. It is our whakapapa that informs us of our strength and lands us firmly upon papatoa nuku. The next section was our tai ao. So this was about creating access to safe and supportive environments which are informed by a Māori worldview, or in our case, te puahatanga. But for our kaumātua, this went beyond having access to supportive environments. One of our kaumātua shared a quote with me: just because the sign on the door says open, it doesn't mean I can walk through it. And the very last part was mana motuhake. It was about uniting the pursuit of kaumātua and whānau to be self-determining. Kaumātua share that they can experience a whole lot of pressure to uphold cultural activities. And so part of being a kaumātua, according to our kaumātua that we did out this mahi with, is that they had a lot of pressure to be available to do things to uphold the mana of marae, the mana of whānau, the mana of whakapapa. So they might receive a phone call really late at night and be expected to be able to sit on the pai of our marae for 3 days straight in the middle of winter. They are also very used to having phone calls to ask, could you please come and do the karanga, the karakia, the waiata for us, but actually not being invited to participate in the rest of the hui or the wānanga. They also shared that some tangi that they had been attending for whānau were not in line with tikanga, and so therefore the risk of our kaumātua being abused in those spaces were incredibly high. They also shared that actually when they are well, when they feel capable, that actually connecting in cultural activities, being a kaumātua, offering to do karakia, these were protective factors for them. But the challenge is when they feel pressured to do so. We had kaumātua share that they had attended so many wānanga, so many hui, that they were not able to fill a simple prescription. And because of that, their health declined really, really quickly. But also they felt the pressure and the burden of actually not saying anything. We saw our kaumātua sharing pills amongst each other. And so for us, it was about recognising that the pressure we put on our kaumātua, we have to ask ourselves, actually, what is it that we're also doing? So I'm not just talking about from a provider lens or even a mokopuna lens, but as a wider community, a wider society, really asking how do we not only protect our kaumātua, but our older people in all of our communities. And so thank you very much for listening to the kōrero shared on behalf of our kaumātua. I really thank you for your time.
Namaste, everybody. And I'm really glad to be here. Sorry if I blabber because I just got back yesterday from a 28-hour-long journey from Greece. Today I'm here to talk about the Indian and the South Asian culture and the seniors. So let me start off by saying today I'm not going to talk from an academic perspective, but from the heart today. And because for us, from where I come from, elderly and looking after the elderly comes from the heart. So we don't live in a perfect world today. It never was, I guess. But then I think, how do we make this world perfect? And I think many people would say, it's not my problem, let the world run as it is, why should I bother? But I think all of us here are here today to make sure that we correct the imperfects and inequalities in that world. Elder abuse is a menace worldwide, everywhere, and every single person who is affected by elder abuse does suffer in a similar way. But when that elder person comes from a more vulnerable background, like an immigrant or a minority community or a refugee, they have added barriers which actually makes them more accessible to elder abuse. So some of the barriers might be the language, not knowing the language where they come from. See, most of these elderly migrants who come from wherever they come from, India or South Asian countries, some of them come willingly, some of them don't come willingly. They have to come here because they follow their families. And in our culture, we are supposed to look after families. And most of them do. I'm not going to paint my community black. Most of them do, but every community has got some issues, some bad elements where, these things do happen. So we just can't say it doesn't happen, it does happen. So when they come over here, when they are in the late 80s, 70s, how does that person adjust to a different language, different culture? It's such a cultural shock for them. They leave behind their families, extended families. And there's a lot of power equation that changes when they come here. From givers, they become takers, dependent on family, which makes them more isolated. And there's a big cultural shock, and with westernization, the families are becoming more nuclear, and the changing values. And elder abuse is a topic that has got a lot of cultural stigma. It is just not spoken. If you go and talk to the community, a lay person, and said, hey, do you know about elder abuse? He says, what elder abuse? There's no elder abuse in our community. We look after our elderly. So denial is the first thing you will, see that if you ask somebody about that. And there's absolutely no lack of understanding or awareness of what services are available in the community. Where do they go, if at all they want to ask for help? First of all, asking for help is a big thing. And if they want to ask for help, what is available for them is not known. So they have these added barriers which they have to come out of before they even think of asking for help. So what actually works for our community is our culture. Our culture is so strong and so ingrained in all of us that it really works for us if it is practiced in the right way. But again, I'm saying, that, because of the westernization and globalization, colonization, that culture is being fragmented. And people are actually interpreting the culture to their advantage. That's where the problem comes. But otherwise, if you see as a culture, it is a very holistic culture, it's not an individualized culture. For us, the family is a unit, and it's very important to work with the family. So that is what works with us. So in our practice, when we work with seniors who are abused, we approach it in a very different way from the mainstream. We approach the family first to see what is actually causing that stress in the family. So that actually helps us to work, because sometimes it might be small things like adjustment in this new country, and some expectations also from the elderly causes stress actually, because from where we come from, it is expected that the children look after them, make food for them, do everything, But small things like we tell our elderly, when your daughter-in-law comes back from work, give her a cup of coffee instead of expecting for her to come and make a cup of coffee. That might be a small thing as such which is causing a problem to the daughter-in-law, and she gets stressed. So these are the small things which we work, but for that we need to work with the family. We just cannot work individually with one person. In the van, just remove them from the family, that doesn't work for us. And collaboration works for us actually, collaborating within the community first, within the family, the community, and the service providers and the organizations. Because most of the policies and most of the services are not in tune with how they can actually help our people. So I think it's very important to collaborate and educate people about what our culture needs and how the services need to be centered across that. Family-centered approaches which respect our cultural values actually works for us. And of course, the awareness campaigns. As I said, there is no awareness in our community, so the awareness needs to be there in the community. And of course, there is a lot of gaps in the legislation as well. There's not much cultural specific input into the legislations which are made. Legislations are made, sorry to say, in Wellington by a white person, a young white person sitting there in Wellington who doesn't have an understanding of the diversity of this country. You know, there's so many people who are coming into this country who are so diverse, but you need to have that diversity somehow channeled into those legislations, I think so. And there's not much cultural training for the mainstream service providers, and very much limited data collection on elder abuse. I think just now they've started doing that after so much of advocating for that. There is very little data on elder abuse from the South Asian and the Indian communities. And of course, culturally specific activities, practice is important. I just want to share one case I've been dealing with a long time, just to show you that how much culturally appropriated services are important. There is this family consisting of two, an elderly lady and her daughter who is intellectually disabled, non-communicable. They were, thanks to the New Zealand government, they have been managing for the past 15 years. The family who bought them have gone to Australia, leaving them here. So they have been looked after very well by the home support services and all that. They managed till now, but now they're coming to a stage where that elderly woman has been diagnosed with leukemia, and she can't look after herself or the daughter. So we are trying to now get them into a care. But because their needs are different, they are saying that they cannot put them into one place. They have to separate them. Again, talking from the heart, if you separate them, they are not going to survive, because all they have is two of them. So the younger one, the daughter had Taikura Trust, they had a little bit of understanding of culture, but the mainstream, they said, no, they have to be separated. So now I'm now fighting, it's a big fight, to put them both into one place. And because they cannot speak English, and you know how, they won't survive. You know, if you think from the heart, they won't survive. I know that they won't survive at this age. The lady is already 85. So that is the level of non-understanding of cultures. So that's what we actually should work on. And we actually talk a lot about research and planning and things, but how much of that reflects in the policies and in the services which we are providing for the seniors. And coming to the funding, we all know this government is cutting more and more funds. And there is hardly any services specifically for Indian and South Asian regions. It's just 1 or 2 contracts given for the whole of New Zealand, and those are in Auckland. Because of the immigration here, a lot of people get more points when they go out of Auckland, so people are settling in so many places. But issues are there as well. But there is no funding or no organizations looking after those apart from Auckland. So many of the services in Auckland, the few in Auckland actually have to work across Auckland towards the whole of the country. So that's a big, big, big gap. You need more culturally appropriate organizations who can work with their own people, which works for them. So, yeah. As I said, there is a saying in our culture, if one swims, they can sing, but if you swim collectively, you rise. So I think today the time has come where we need to be collective, collaborative in our approach, and try to work together to remove this menace from our communities. Thank you.
Kia ora koutou katoa, he mihi mahana ki a koutou. Ko Soda, Crows to Waka, ko Leith to Awa, ko Signal to Maunga, no Holland, Netherlands, o ko Tupuna, ko Hanny tako ingoa. I want to express gratitude to be able to be here today. I want to express the concerns that many people will bring here today, and the gratefulness that we have the opportunity to be here in this amazing whale. And I need to know how to use this. Okay. We know that we're here because we're concerned about older people, but in fact, looking at the issues of elder abuse, I believe, are looking across all the 5 areas. Because most of the older people that we meet with in Age Concern and have done in various forms for at least 30 years is they're not talking about the words. We spent this morning talking about definitions. What's elder abuse? Is it elder abuse? Is it abuse of older people? Are we using the right word now? No, it's harm. No, it's distress. Whatever word we use, it's not the words that older people necessarily express themselves and not necessarily even know that this is what's happening to them. Some issues with diminished capacity, but also in some instances, people know that something's happening, but if they speak up, things will get worse, and so they're not going to speak up about it. So let's be real, whether it's named or not, that doesn't mean that that's not what we're talking about today. But for us, elder abuse isn't an older person's issue. It's actually a family issue, and we see that whenever we meet, as Nilima said just before, and as various speakers have said all day, we're talking about an intergenerational issue. And we're talking about a much broader issue than defining people as victims or abusers or perpetrators. We're talking about a whole system that creates discrimination, that abuse can happen to older people. In this instance, as already was described previously, can happen long before people get to an age that they might be described as older people. And part of that is the agencies, the organisations that we might be a part of, that older people interact with, that families interact with. And that's why for us what was pointed out before by Sandra is that as we categorise elder abuse, one of the categories we have is called institutional abuse, which doesn't mean what happens in rest homes, even though a lot of people think that. It's actually about the policy or practice of any organisation that can impact older people. So we see it as much broader, and we also see that often it's an agency that brings the matter to our attention, or it might be a family member rather than the older person themselves. So we see organisations as part of that, and sometimes it's organisations that have lost contact with the older person. That's where the question of the abuse is sitting. There's been a lot already said all day, and I'm not going to repeat all those things about what's already been said about different communities, but one of the things that we need to all realise is that sometimes it's safer to raise issues within your own small community of identity, just like sometimes it's safe to talk in your own family about what's happening, but often it's not. It's not safe to talk in your own family. It's not safe to talk in your own community of identity. And sometimes it's actually safer to talk to someone outside. So I just think we need to be here really clear that there isn't just one pathway to work with elder abuse. It can be through many different pathways. We need to listen out in whatever form that's happening and listen to people who may be raising the questions. And I think that's what often in Age Concern we do, is we're listening to people raising the questions. I always remember the man from a small community in his 80s saying to me, "Who would believe me? Who would believe that my granddaughter could do this?" Now, they used another language. I'm just saying to you that that's the reality that we're sitting with. Who believes us? And we've already talked about all the range of forms of discrimination that people are already experiencing as part of their lives when it comes to ageism. And while there's much more public discussion about racism, sexism, discrimination against people's sexual identities, whatever, ageism is not widely understood. And even when ageism is used, it's sometimes used in the frame of what's happening for young people. What people don't understand often is that we ourselves imbue a lot of the values of ageism. And often when I'm talking to people, I'm talking about what's the jokes that are made in your families about older people. How often do you say, "Oh, when you kick the bucket, I'll do this and this"? We all make jokes. We only have to go to the cosmetics centre to see all the anti-aging creams or the birthday cards in the racks that always make jokes about getting older, but you're not that old. There's a lot of range of values that sit behind what happens in whether older people's opinions, whether older people's choices, whether older people's preferences, regardless of whether older people's needs are being met, but all of those things imbue what happens in elder abuse. I'm using the question that was put for the naming of this workshop today. So, who is it whose knowledge is privileged? While we talk about who knows, I just think it's important to say that you might be surprised to know that back in the 80s, there were workshops like this, not being run by professionals, not being run by paid people, but being run by older people's voluntary groups, like Age Concerns, raising the question saying, hey, there's this thing about elder abuse. And initially it was the question of what was happening in West Homes, but also this is a movement that started from older people themselves who have realised that something is not right and needed to name it. And from those first workshops and some collaboration with the Ministry of Health, the first documents were written in 1992. By then, services had already started to be established in some centres with no funding or local funding, and in 1992 was the first lottery's support of 7 services. I guess what I'm saying is when we're talking about what's the current state of knowledge, we need to know where it's come from. What is it that we know? What is the practice that's developed? I know that we're all here today with a very clear purpose. I know that we all want things to change. We've been talking in our groups about what needs to change. But we come with different perspectives. From an academic point of view, publish or be damned, we need to publish, we need to show. But is it the publishing that changes policy? Is it the publishing that changes public opinion? Is it the public that makes the changes towards the government changes that need to happen? How do we know that we're going to get funding unless we show what's changed? I think those are all the sorts of questions that we're asking today and come out in various forms where I've been sitting. I don't know whether you've been sitting, it's the same. The reality is, though, the more evidence there is shows that more people are willing to talk. We, over many, many years, and in a previous contract, was actually part of the contract was to provide public awareness and education. Anytime you talk about elder abuse in a group, and I'm looking at Diane, I'm looking at other people in a group who spread it, who talk about it, what happens afterwards, Diane? People come up and talk to you about it. I guess I'm saying to you is that while we're here to prevent abuse, we're actually going to find more of it, because the more more public discussion about it, it actually increases the number that report. But that's very different from saying it's increasing in number. All we're saying is back in the 80s, there was no contracts, there was no services, but people were saying something about it. 100 years ago, there were people who experienced sexual abuse as children. When did we start saying sexual abuse for children happened? I was around in the 70s, most of you weren't, well, but I was around in the 70s when suddenly that became a big issue. Just because we're talking about elder abuse now, it doesn't mean it hasn't always been happening. And if we can prove by our statistics how many people we see and work with, which is how Age Concern presents all our knowledge, we only talk about the cases that we've dealt with, the people that we've seen over the last 30 years. Increasing numbers proves that more's being reported. It doesn't prove there's more abuse, and we need to be really clear about that. Whether people have a name for it or not, it doesn't mean whether it's happened or not. And I think that's where some of the discussion is about, you know, is it abuse or is it carers not getting what they need? Is it that somebody feels their discrimination? It all tallies up to the fact that these things are happening and these people are being harmed, which is why when we ask who benefits. We need to ask it from all of our perspectives here today. From a research perspective, do we need to show we need funding? We're already slamming Tim over there about what's going to happen next year. From a policy perspective, how is it that we get to change? We've had a change in government. Does that change government thinking? Is it what we show? How do we do that? From a service provider point of view, how can we prove that we are overrun? How can we prove that we tried to do things differently unless we get more funding to do more? And so when I ask the question, who benefits? Ostensibly we're saying older people, but I actually raised that in a room like this, what we're saying is, in fact, that's only part of the picture, because what we talk about today isn't necessarily stopping the elder abuse that's happening right at this moment today. What we're looking at about in a much bigger picture, because we don't see elder abuse as a thing here. We see elder abuse as a part of a whole person's well-being. And so stopping one particular version of elder abuse doesn't mean that their lives are any better. In fact, if it means that you're not going to see that family member again, are you going to report it? If that means that your advice is to trespass that person coming to your house, which means they won't see you because they've already threatened if they can't come to you, you're never going to see the mokopuna again. Are you going to carry that through? Elder abuse isn't as simple as saying we can stop that. It's much more complex than that. So when it comes to the critical gaps, what are they and where do they come from? Is it research that shows up the gaps? Is it what we hear from other countries, other people's definitions as we were shown this morning? Or is it a journalist, like happened with the unfortunate experiment that actually brought out a whole change of government policy, laws, and a whole new service? Who is it that identifies and describes gaps? Who is it who sees what's going on and knows what's going on? You've heard it from several angles already today, and I put to you that practitioners, the people who've been working in the field, the people who have been trying in different ways, and the agencies that have tried in different ways, often they're the ones that actually know what they can't get to. You know, 30 years ago in the 1990s, they started up this new system called the NAS, the Needs Assessment Service Coordination, and one of the things they had to report on for every 3 months, they had to report on the gaps. Now, I was around working in those days, and it was really interesting because I asked them, well, what happens? You report on the gaps, what's missing, but nobody knows what's happened to it. So I put this question again today, not that we're saying nothing's going to happen to them, but it is part of the question. If you're going to ask about what are the gaps, you're going to ask what needs to happen, and you need to be talking to people like Kai over there, people in practice, to say, what are the gaps? What are most needed to be looked at, and how can we further do that? And let's not say, well, wait till a new law comes out, because we already know that law doesn't change people's opinions about what is elder abuse. And a lot of what happens in elder abuse we can look much more broadly at than just what a law does or doesn't say. If we're looking for the well-being of older people, we're looking beyond what a law can tell us. But the biggest question I want to leave you is, what are we doing about the gaps? And how can we show what we're doing? I was asked recently about self-neglect and what was the gap in self-neglect. You know, we've written reports for more than a dozen years that have included what we're doing about self-neglect. We've done training, we've done lots of things that are happening in local communities. One community is trialling this, combination with several agencies trialling that. So what I'm suggesting is it's really important to find out what's happening. And maybe it's not happening nationally, maybe it's not happening in Tamaki Makaurau, but it might be happening in Tairāwhiti. So you've got to be looking much more broadly and say, hey, where might we learn something about what's happening? Where are the gaps? You know, it's a New Zealand tradition that we start off with an idea, and you've seen that even in this year, there are community organisations that have started off doing something in their own community because they've seen a gap. And that's been the history of how things started. Elder abuse, we've started services over a long period of time, but we've still got gaps in lots of ways, and that's what I hope that today we can share more about and move into what we're going to do about them. Thank you.
Thank you so much to all of our panellists in that session. I took away something from every single one of you. Danielle, I love thinking about pūrākau. Such a powerful, it's just taking us back to the stories that we know is so powerful, and I thought that was such a beautiful kōrero. And I love whitebait. Just made me kind of think, I've only just had lunch, but now I'm thinking about whitebait fritters, so thank you for that. Nilima really made me think about how we look at systems and we expect people to adapt to systems and to services, right? So it's like we look at people who are in need and we say, well, this is what's available. How do we kind of turn them into a pretzel so that they fit into kind of what we actually have in terms of a solution, rather than seeing people as people. If we took a people approach, a whānau, a family approach, we would never be thinking about separating a mother and her disabled child, because that's what fits into the services that we have arranged around funding or any other kind of mechanism. So how do we switch that around in terms of starting with people first? And finally, Hanny, thank you for all of your challenges and reminding us that this mahi's actually been going on for decades. We're not kind of, suddenly kind of turning up today and saying, oh my gosh, we've just noticed this is a thing. There is so much work that has happened from so many people along the way, in communities, in research spaces, in policy spaces as well. And really today is just an opportunity to ensure that we're keeping those conversations going, bringing the new people in as they come through, acknowledging those who have been doing the mahi for a long time. So just also want to acknowledge organisations like Age Concern, but also all of the community organisations that are joining us in different spaces for today's hui. So that was a bit of, sorry, I know we're question and answer now, but I just had to get my oar in first. Aroha mai for that. So we do have some time for questions, and we've got, again, the roving mics. We've got a question over here to kick us off. Kia ora.
The question, my question is for them, the policies makers, is first thing the funding that is cutting off. There's no more training for staff, for the community, for the youth, that we have to change the mentality of the people, that how we are going to respect our elderlies, and if it is disabled, how we are going to look after them. And the last thing that I'm requesting, all other agencies or MST, if there is any complaint boxes near to their receptions, because the elderly is no more using that Googles to go on Google and MSD website to go and complain, because they used to be in 1980 and just put in a piece of letter and put it in the box. I have a problem. If it's that's his request. Thank you so much.
So I guess some challenges there around how do we maintain, let alone kind of build on services, given some of the challenges that we're facing with different funding, changes in policy. Is there any reflections from our panellists on what can we do? What do we keep doing? What can we do differently?
Trying and advocating with the government services, that's all we can do from the committee. I think we just had to keep trying, advocate from our community, strongly put in our voices there till the change happens. I'm seeing a slight wave of change happening, some here and there, but just now, last year, they've given some funding for the elder abuse research. So that's a small change, but then I just guess there's nothing much we can do from the community level except keep putting in our voices, raising our voices against, and
I think you've already raised it, but sometimes it's the collaboration. Sometimes when you're one organisation trying to meet the need of one person, that's really hard to do, but when you can get a collaboration going, and there's some discussion here about what collaboration's needed, what's worked traditionally with us, with elder abuse workers, is because there's traditionally only been one elder abuse service in each town, each elder abuse worker has had to have a networking connection with a range of other organisations, both government and voluntary organisations, and that is often a better way, sometimes not for a short-term answer for one particular person, but it's obviously the way that long-term change happens. In a previous iteration, what elder abuse workers in aged concern were charged to do was to develop what was called an advisory panel, and that was a way of ensuring that you had representatives from government, from police, from lawyers, from accountants, from doctors, as well as community agencies, so that the elder abuse worker was a known person in the community, but also had allies, and having allies both in government services and in voluntary services is really really an important way, not just for elder abuse, I'd have to say. It's a community development approach in a lot of ways, but an important in terms of advocacy.
And I think your point, Hanny, about all parts of the system need to work together. We can't solve this just in community, we can't solve this just in government, we can't solve this just through research. You know, the more we can look across all of those things and work out where those connections are and talk to each other and try and weave together, the more likely we are, I think, to kind of build sustainable change. I think we're going to head now into our final workshop session for the day, so I know you've probably still got more questions. Maybe discuss those at the tables, because we do want to make sure that we have time, to keep time for our final speakers of the afternoon. I'm going to hand over to Megan, but before I do, just want to again acknowledge the incredible kōrero that we've heard from this panel and say a big thank you. Kia ora.